explain why hyperdynamic circulation is seen in thyrotoxicosis. To explain this question, we first have to define what is hyperdynamic circulation. So the hyperdynamic circulation is a clinical state where there will be increased cardiac output. So what will be increased? The cardiac output is increased. Another thing, there will be increased heart rate. So two things are increased, cardiac output is increased, heart rate is increased. And the third point, there will be decrease in the peripheral vascular resistance or systemic vascular resistance. And the diastolic blood pressure will also be decreased. Okay, so the hyperdynamicity, if I want to explain it, that means there will be two things are increased, cardiac output, heart rate, and there will be decrease in the peripheral vascular resistance, diastolic blood pressure. Okay, so if this happens, so what we will see, we will explain it later, that it will ultimately affect the pulse pressure and the circulation time, and it will cause the shortening of circulation time, and the circulation will become hyperdynamic. Now, why thyroid hormone or how the thyroid hormone is causing this hyperdynamicity? Thyroid hormone has very important effects on the cardiovascular system. One important effect is that it will increase the heart rate or it will cause the tachycardia. Another important thing is that it will also increase what? Now it will increase the contractility of the heart. Now the effect of thyroid hormone on the heart, it happens on the cardiovascular system. It happens in two ways. One effect is a direct effect. Another effect is the indirect effect. So first discuss the direct effect. So directly it can increase, the thyroid hormones can increase the heart rate or can cause the tachycardia. How? Because the thyroid hormones, they will increase the number of beta receptors on the nodal tissues. What are the nodal tissues? SA node, AV node of the heart, they are the nodal tissues. And it also increases the sensitivity of beta receptors to catecholamines. So what they are causing? One thing, they are increasing the receptor, beta receptor on these nodal tissues, and also increasing their sensitivity of this receptor to catecholamines. Now, what is the effect of catecholamine? Obviously, we know that catecholamines, they usually raises the heart rate. So, thyroid hormone, by this permissive action of the catecholamines, it increases the heart rate. That is why tachycardia is a common feature of hyperthyroidism. And second direct effect, so this is on the heart rate. Second direct effect is that it will also increase the contractility and the stroke volume. Directly, how it will increase? So the thyroid hormone, actually it induces the myosin heavy chains. MHC is the myosin heavy chain alpha subtype. So there are two isoforms of myosin heavy chain. One is the alpha and another is the beta. Okay, so with the help of this thyroid hormone, the myosin heavy chain alpha type, their expression will be increased in the cardiac muscle. This alpha MHC, its activity is very important because it has higher calcium activated ATPase activity and it has more actin. So alpha MHC, it will cause more contractility. Okay, so as the alpha MHC, it has more actin and more calcium activated ATPase activity. So if its concentration or expression is increased in the cardiac muscle, so obviously that will enhance the cardiac contractility. The thyroid hormone also, it increases the expression of beta receptors, G proteins and sodium potassium ATPases in the myocardial cells. They also increase the calcium ATPase activity of the sarcoplasmic reticulum, which also facilitates the sequestration of calcium. So all these factors, what are those? One is the activation of alpha MHC. then beta receptor expression is increased, G protein is increased, the sarcoplasmic calcium ATPase activity is increased in the cardiac muscles. So all of them will do what? They will increase the myocardial contractility. And if the myocardial contractility is increased, okay, so therefore there will be increase in the stroke volume. Okay, so beta MHC has low myosin ATPase activity. So expression of alpha MHC will obviously increase the myocardial contractility. And as the stroke volume and heart rate both are increased, so there will be increase in the cardiac output. And this increase in cardiac output will cause rise in the systolic blood pressure. Okay. Now come to the second point, the indirect effect. Here we will see that the thyroid hormone has calorigenic action. It increases the body metabolism, it increases the body temperature. As a result of that, there will be vasodilatation. And vasodilatation means there will be decrease in the peripheral resistance. And we all know the diastolic blood pressure depends upon the peripheral resistance or the afterload. As a result of this vasodilatation, the afterload will be reduced. So peripheral vasodilatation will be there, peripheral vascular resistance will be reduced, and there will be reduction in diastolic blood pressure. So what are the three factors that is happening? Heart rate is increased as a result of this permissive action. Contractility is increased due to these several factors. Okay, so that will raise the cardiac output and the systolic blood pressure obviously, and indirectly due to increased body temperature, there will be vasodilatation and reduction in peripheral vascular resistance, and there will be decreased afterload, and the diastolic blood pressure will be reduced. And what is hyperdynamic circulation? We know that in that condition the cardiac output must be increased, heart rate must be increased, but the peripheral vascular resistance must be decreased. Now see what is the net effect of thyroid hormone. So the net effect on blood pressure is increased pulse pressure. Pulse pressure is the difference between systolic and diastolic. So if suppose this is the systolic blood pressure, this is the diastolic blood pressure. Okay. So if the systolic blood pressure is increased and diastolic blood pressure is decreased, so the gap between them, it will be increased obviously. So the pulse pressure is increased. White pulse pressure is a prominent feature of hyperthyroidism, and increased cardiac output and vasodilatation makes the circulation hyperdynamic. So the circulation time is shortened. So with this we can say that hyperdynamic circulation will happen in thyrotoxicosis or hyperthyroidism. Why? Because thyroid hormone in the cardiovascular system, it will cause what? It will raise the systolic blood pressure, the heart rate, cardiac output, contractility, but at the same time it will cause reduction in the peripheral vascular resistance and diastolic blood pressure. So the pulse pressure is increased and the circulation time is decreased. So this increased cardiac output and vasodilatation will make the circulation hyperdynamic.